Have you ever had severe period pain that you couldn't even go to work, go to school, or even get out of your bed? Many women are told it's just normal period pain, but while mild menstrual cramps are common, pain that stops you from living your normal life is not something you should ignore. One possible cause is a condition called endometriosis. Hello, my name is Chinaza. I am a medical sonographer, and on this space, it is everything ultrasound and women's health education. And in today's video, we will be looking at endometriosis. Before we talk about endometriosis, let us first of all understand the uterus, that is the womb. Think of the uterus as a small room where a baby grows during pregnancy. Like the walls of the house, the walls of the uterus has three layers. The outer layer, that is the outside wall of the house that covers and protects the uterus. The middle layer, which is a thick muscle. These muscles contract during labor to help push out the baby. Then we have the inner layer called the endometrium. This is the most important layer for today's discussion. So imagine you are having an important guest to spend the night in your house. You would have to clean the room, spread fresh bed sheets, and prepare a comfortable bed before the guest arrives. This is exactly what the endometrium does every single month. It becomes soft, thick, and rich in blood supply, preparing a comfortable place for a fertilized egg to attach and grow into a baby. If pregnancy happens, that lining stays in place to support the pregnancy. But if pregnancy does not happen, the body no longer needs all those preparation, all those prepared bed. So it breaks it down and removes it. That is what comes out every month as your monthly period. Now imagine if these pieces of that special lining of the endometrium somehow starts growing in a place where they don't belong. So instead of staying inside the uterus, they begin growing on the ovaries or the fallopian tubes or outside of the uterus, the bladder, or even the bowels. This condition is called endometriosis. And here is where the problem starts. Every month, these misplaced tissues still respond to your body's hormones just as if they are inside the uterus. They become thicker and they may even bleed. But unlike the blood inside the uterus that leaves during your period, this blood has no place to go. So it becomes trapped inside the pelvis. Your body reacts to this trapped blood with inflammation and irritation. As the body repeatedly tries to heal itself month after month, scar tissue begins to form. Over time, organs that should have been able to move freely begins to stick together. This is one of the reasons many women with endometriosis experience severe menstrual pain. Some women also experience pain during intercourse, pain when passing stool or urine during their periods, heavy menstrual bleeding, chronic pelvic pain, or even difficulty getting pregnant. Sometimes when this abnormal tissue grows on an ovary, it can bleed a little every month. And because this blood cannot escape, like I said earlier, it collects inside the ovary and gradually forms a cyst. As months pass or years, the trapped blood becomes thick, dark brown and sticky, looking more like a melted chocolate. This is a type of cyst called chocolate cyst or an endometrioma. And please, it has absolutely nothing to do with eating chocolate. It is called that because of the appearance. Now, let's talk about the role of ultrasound for diagnosing endometriosis. Many people believe ultrasound can diagnose every case of endometriosis. That is not true. Ultrasound cannot reliably see every type of endometriosis. However, it can detect some forms, like the chocolate cyst in the ovaries. In experienced hands, ultrasound may also be able to detect deep endometriosis or signs that some pelvic organs have become stuck together because of scar tissue. So a normal ultrasound does not completely rule out endometriosis. So if you're having severe pelvic pain and you go for a pelvic scan and they tell you your ultrasound scan is a normal study, that does not completely rule out endometriosis. Sometimes your doctor may recommend further tests such as MRI or a surgical procedure called laparoscopy, which is currently the best way to confirm the diagnosis. Some women are more likely to develop endometriosis than others. The risk is higher if a close family member has it, if periods started at a very early age, if menstrual cycles are short, or if menstrual bleeding is very heavy or lasts for many days. One interesting thing about endometriosis is that the amount of pain does not always match the severity of the disease. Some women have extensive endometriosis with little pain. Others have only small areas of endometriosis but experience severe pain every single month. So never judge the condition based on only how much pain someone has. The good news is that treatment is available. Depending on your symptoms and whether you plan to have children, treatment may include pain medication, hormonal therapies, or surgery. So if your period is so severe that it interferes with your daily activities, don't simply assume that it is normal. See a healthcare professional for proper evaluation. Early diagnosis and treatment can improve the quality of your life, and for some women, it can help protect fertility. Remember, endometriosis is not just bad period pain. It is the tissue of the endometrium that has gone to the wrong address, and it's still behaving as if it is still inside the uterus. If you found this video helpful, don't forget to like, share, and subscribe, and follow for more easy to understand ultrasound explanations and women's health education. And I'll see you in my next video. If you have any question or contribution, leave it in the comment section.